Never in a million years would I have thought I was going to be someone with heart problems at 27 years old. Sure enough, atrial fibrillation. And I'm like, this can't be right. I am 27 years old. So I'm like, there's no way. I have AFib. Every doctor that came in, their eyes went straight to the monitor, stood like this, looked at me and said, you're too young for this. They said, no exercise, only walks. And so that was like gut-wrenching to me, to the gym rat that's going multiple times a day. You know, I'm trying to work on CrossFit, run, you know, we're rowing, we're lifting weights, powerlifting, all of it. So I was just like, you can't be serious. And they're like, no, you can't, you walking until you see a cardiologist.
Hi, my name is Haseeb Jafri. I'm a cardiac electrophysiologist or a heart rhythm specialist with Kettering Health. AFib is a fast heart rhythm that starts in the top left chamber of the heart. Normally, it beats 60 to 100 beats per minute every minute of your life. That's normal. In AFib, your normal rhythm goes to sleep. And again, the top left chamber starts to beat 300 to 600 times per minute. AFib is not very common for somebody as young as Nikita. AFib in the young, as it's described in the literature, is extremely rare. It's 0.001% of the population.
I met Dr. Jafri. I was just nervous because the term ablation kept coming up, and I wasn't sure what an ablation was. Just any sort of a procedure in general on my heart. I only have one.
We've had great technological advances in electrophysiology over the course of the last 10 to 15 years. We have thermal ablation technologies, both cryoablation and radiofrequency ablation or heating ablation, that can go into any area of the heart and cauterize specific cells. In Nikita's case, we used the heating strategy or the radiofrequency ablation. We cauterized around the areas where AFib starts to help protect her from having it again.
He was incredible. I met him and he was probably the easiest person to talk to. He just was I felt very heard and very welcomed with him. I felt safe. And I just remember looking at my mom, I was like, he's good. Like, he's gonna be a great doctor.
With ablations in the past, if you go back 20 years, those procedures sometimes took up to 8 hours a day. Patients were hospitalized overnight. Now what we tell patients, the procedures generally take 2 hours from the time they get into the room to the time they leave. And generally, they can leave the same day.
I have so many other things I can do and that I want to do. I'm just loving being able to do anything I want at this point. So it's been a crazy journey.
With her physical fitness and her ability to adhere to lifestyle treatments, which I counsel all patients on, I was very confident that she would do very well, and she's done remarkably well since her procedure. Every time I see a patient, I want to make sure that I tailor the therapy specifically to them. In terms of heart rhythm care and electrophysiology, it is a ever-changing field. Every single year, every couple of years, we have new treatment strategies that come out. And the beauty of working with the partners that I have who are excellent and working at Kettering Health, we partner again with leadership to constantly review what's out there. What can we bring to the forefront to better help treat our patients? That's why I love working with the group of people that I do at the place that I do.